Hi, welcome to the Epilepsy Foundation's Dare to Go the Distance, Taking the Epilepsy Journey. My name's Patty Osborne-Schaefer, and I'm joined by Dr. Nathan Fountain and Sandy Dewar. In this session, we're going to be talking about getting diagnosed. And this is one of the first steps along the journey, and really a pretty difficult one, because unfortunately, there's not just one magic test that's going to help tell whether or not a person has seizures and epilepsy and what to do. So I'd like to direct my first question to Dr. Fountain and ask him, what type of healthcare professional should a person see if they think that they're having seizures or someone's told them that they're having some episodes that look like seizures?
Well, of course, the place to start is with their primary care doctor, their family physician, to look into all the many different things that could be causing episodes. For example, at one extreme is children who frequently stare off in space. I know my own children frequently stare off in space and don't respond to me because they're ignoring me. That's a common problem. But of course, if you're concerned there's something more than that, then a place to start is with your family physicians. There are other things too. But as soon as their family physician says they've had seizures, or someone else tells them that, or they recognize they have seizures, then it's really a neurologist is the place to start. A neurologist is a physician in medicine who specializes in neurology, and epilepsy or seizures is a neurological problem. And of course, the next step after that is to see someone who's a specialist in neurology that's a specialist in epilepsy, so an epileptologist. And that would be the next step if things aren't going as they'd expect with their neurologist.
Okay, so at least we know where to start. Primary care, neurology, then an epileptologist or epilepsy specialist. Now, along the journey, what I hear from many people, and I know I was confused about this myself when I was very young, is the words that people use. So many times people, will or a healthcare professional will tell, a patient or family that, you have a seizure disorder. And other times people use the term epilepsy. So, Sandy, could you tell us what do these words mean, and are they the same or different?
Patty, I think it's a very important question. Patients will very often be told they have a seizure disorder and then not understand that, in fact, the term seizure disorder and epilepsy are frequently used interchangeably. They will say to me, I have seizures, but I don't have epilepsy. And this creates, again, an obstacle to moving care forward because people minimize the impact of the seizures and, may not gain access to a treatment which, would be beneficial. So I think it's important for people that have seizures, have epileptic seizures, to understand that this is, in fact, epilepsy.
Thank you for joining the Epilepsy Foundation on our series, Dare to Go the Distance, Taking the Epilepsy Journey. For more information and resources, please visit epilepsy.com. You can also contact the Foundation through our 24/7 helpline in English or in Spanish by calling 1-800-EFA-1000, or go directly to epilepsy.com and send us a message through there.